Many of us avoid certain people, like needy relatives, or activities, like physician-recommended healthcare or going to the gym on a regular basis. But when does this avoidant behavior cross over from normally expected behavior to a more serious problem and become avoidant personality disorder, or APD? In this video, I will explore the 7 criteria for avoidant personality disorder. Welcome to my channel. I'm Dr. B. I'm a board-certified fellowship-trained physician, and I've been caring for patients for over 20 years. I make educational videos on interesting medical topics. Watch this video until the end to learn how avoidant personality is actually very different from, and how to distinguish it from social anxiety disorder, which is very common and can look similar. Individuals who meet the criteria for avoidant personality disorder are often described as being extremely shy. Now, being shy is actually present in about 40% of the general population, and this word is used to describe those who are inhibited in new situations, fearful of disapproval, and fearful of social rejection. But the intensity of the symptoms and level of impairment in avoidant personality disorder is far above and beyond anything that occurs with the trait of shyness. Avoidant personality disorder is characterized by a pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. Pervasive means that the avoidant behavior extends to all facets of one's life and dominates an individual's every day and every thought, extending into all areas, including work, school, friends, family, all activities, athletic and otherwise. In addition, it's chronic, being present year after year throughout one's life. Because of this pervasiveness and the chronicity, avoidant personality disorder becomes a major component of a person's overall character and a central theme in an individual's pattern of relating to others. The American Psychiatric Association uses the Diagnostic and Statistical Manual, 5th edition, or DSM-5, to define avoidant personality disorder, and the manual requires 4 of the following 7 criteria. Number 1, someone with avoidant personality disorder avoids occupational activities that involves significant interpersonal contact because of fears of criticism, disapproval, or rejection. This means that those with avoidant personality disorder will choose to be fired, choose not to be promoted, or even to be demoted, rather than enter into a situation where they can be rejected or risk criticism. When they are required to participate in a collaborative group or a meeting with others, those with avoidant personality disorder will often be late, sick, or even have an emergency that suddenly comes up, or they might have another meeting, something so that they don't have to overtly refuse to participate. Using this technique or these techniques, sometimes this can preserve their job. Number 2, an individual with avoidant personality disorder is unwilling to get involved with people unless they are certain of being liked. Because of this, for those with APD, emotional involvement with others remains very superficial, very peripheral. Those with APD will use nonverbal cues from those around them to determine if they are liked, trying to read the room and read the situation to determine their level of approval from others. Unfortunately, with APD, the level of insight is very poor, and so the interpretation of cues, even if adequate, and if they are present, are often in error. Number 3, those with APD show restraint within intimate relationships because of the fear of being shamed or ridiculed. Those with APD keep others at arm's length. Partners, friends, all people complain that there is a lack of deep conversations, no discussion of real issues or investment. Now, this is much different than other personality disorders in that those with APD often have a very real desire to have friends. They desire to have close associates, intimacy with both friends and romantic partners. However, with APD, individuals cannot make that step. They cannot take that step to extend themselves, to become vulnerable and expose themselves to even those close to them. Number 4, those with APD are preoccupied with being criticized or rejected in social situations. Now, this isn't just occasional thinking about it, but rather a fixation, a fear of rejection. As a result, there is active avoidance of all parties, get-togethers, lunches, small group meetings, and team building activities of any type are off the table. If forced into any of these activities, their degree of social awkwardness is then extreme, with odd behavior that self-confirms their rejection, and the cycle continues. Number 5, those with APD are inhibited in new interpersonal situations because of feelings of inadequacy. When forced into new situations, the behavior of an individual with APD is dominated by shyness, being uptight, being unwilling to speak with others, and the individual with APD may even stutter in conversation, even though they don't have an underlying history of stuttering. Again, the overall presentation and takeaway can be of extreme social awkwardness for both the person with APD and those around them. Number 6, those with APD view themselves as socially inept, personally unappealing, and inferior to others, which is often flawed. This, however, relates almost entirely to self-assessment, which is often flawed. It is not based on actual appearance, skill set, intellect, or even a realistic appraisal of themselves. Instead, for someone with avoidant personality disorder, their degree of insight into themselves and how they compare with others and how others see them is faulty. Number 7, those with APD are unusually reluctant to take personal risks or to engage in any new activities because that may prove embarrassing. There is complete refusal to begin, learn, or participate in new activities. This can be athletic, like learning to water ski, personal, like dating, or occupational, like attending a conference to learn a new computer program. Again, not because of lack of desire, but because of fear and fear of the risk. This can have long-reaching consequences. For example, those with APD may have a deep desire to enter into a marriage and eventually have children and a family. However, that requires the initial step of dating, and those with APD cannot and will not take that first step of either asking someone out or accepting a date when they are asked out. Again, because of the perceived overwhelming personal risk. So how does avoidant personality disorder differ from social anxiety? Well, there's a broad overlap between social anxiety, which is very common, and avoidant personality disorder. However, what separates the two is the global, pervasive, and all-encompassing nature of APD, combined with very poor personal insight and a poor evaluation of themselves in relation to others and others' evaluation of them. Social anxiety, in contrast, it is in response to specific stressors that are easily identified, such as school events, attending a party, or an athletic events. Those with social anxiety are often quite insightful. They can understand what is triggering the anxiety, and even more so, they have reasonable insight that their response is irrational or unreasonable. And they understand that it is especially unreasonable to feel the way that they do. They may and often do struggle to control how they feel and act, but they are much more aware of themselves and have a much more grounded evaluation of others and others' responses to them, including those important nonverbal, behavioral, and social cues. Now, those are the 7 criteria for avoidant personality disorder. Thank you for watching. And if you're interested in more personality disorders, try these shorts or click on this video about narcissistic personality disorder. And don't forget to hit subscribe.